Okay. Thanks, everyone, and welcome. We are so excited here today to have, and we are recording. So if there are any of you who would like to turn your videos off, I believe the recording doesn't actually record the folks on video, but do know that we are recording. So you're welcome to turn your videos off if you'd like for this part. And thanks for letting us save it for the people who couldn't make it tonight. We're here today to tell you about our program, Maternal-Child Health Systems, but I'd like to start first with our land acknowledgement. And we acknowledge that the lands on which Bastyr University stands, you can see some of those lands behind me, and on which we hold our webinar today, are the traditional, ancestral, and contemporary lands of Indigenous peoples, particularly in my area, the Wenatchee or Pisquosa people. But when we're in Kenmore, the Coast Salish people, whose spiritual connections to these lands form the foundations of their ways of being. We recognize and esteem the values, vast knowledge, and collective wisdom of these nations from the past and present. We honor their resiliency, and we recognize the history of oppression, racism, and extreme hardship that has and continues to affect their communities. We at Bastyr University endeavor to be stewards of the land on which the institution stands, embrace Indigenous ways of knowing through our programs and initiatives, and strive toward policies and practices that bring about justice and reconciliation. We understand that land acknowledgement is only the first step in honoring the contributions of Indigenous peoples today. We ask that you take some time to learn more about the land where you live, work, and play, and that you reflect on your engagement as we manifest these intentions as one Bastyr community. Any of you can feel free to share if you have resources, that are specific to your own community or that you like to support in terms of reparations. I'll share something at the end as well. There's a company here, Wenatchee Wear. So if you're ever looking for gifts, it's a great place to look for gifts. All right. So everyone will spend just a little bit of time talking about the program tonight because everybody comes from different places in terms of, some folks have already applied, some are deciding. And so we wanted to share just a little bit about the program, but we'll leave lots of time to hear from our 3 alum who are here today. Thank you so much, Colette, Cassandra, and Amanda. And then we want to definitely leave lots of time for questions as well from any of our prospective students. So thanks again for being here today. So we're specifically here from the Department of Midwifery, but to introduce you to our program, which is a master's degree in maternal-child health systems. You can see here myself and Dr. Taiwo, who are here today, our core faculty in this program. So we are happy to answer questions that you have. And we'll also have, just a short agenda, as I said, with our slides, but kind of letting you know a little bit about how the program came to be, thinking about the curriculum a little bit, describing the who and the why of the program, and a little bit about prerequisites and the kind of students we're looking for. So feel free to put your questions in the chat. I won't be able to see them right away, but we'll be sure to get to them. Or Tanya, you can interrupt me if you notice something that should come up right away. But we'll be sure to leave lots of time for that as well. So this program was created because, as we all know, perinatal and postpartum health around the globe, but especially in this country, and especially for Black women and infants and Black birthing people and families. There's so many inequities. We really want to be a place where folks can come to help solve the problems because they know how to do so from their own communities. And so we get the most amazing people. It's just so fun. I really love learning alongside all of you because you come with a wealth of knowledge and experience. So we learn together, and we also offer you ways to just transform these systems that we all know have many, many places for change. So this is a fun picture from Colette. Thank you so much for sharing this. She was on Public Health Live as a student. And really, it's because of folks like all of you that we have this program. Because we know that there are all of us out there, right? Midwives, I was a clinical midwife for 9 years, doulas, childbirth educators, lactation support professionals, community health workers, and we are out here and we're doing the work. We're doing that good work, but we know that there's more than just that one-on-one work that also needs to be done. So we're so happy that we have health professionals out there serving individual birthing people, pregnant and postpartum families, and infants. But we also need just as many folks as who are willing, who care about these issues, who are out there working to change the systems that need to be broken down in order to improve health and health equity. Why now, right? And as you all know, just our advocacy, our leadership, our models of change are urgently needed to reduce and ultimately eliminate the inequities in our system. And so, you know, as we said, you're already doing the good work. And this one-year master's degree was created for folks like you who want to, you know, just hone those skills and be able to take your work to the next level. So what does it look like? It is possible to break it down into 2 years for folks who want to go part-time, but for many folks, they want to get it done. So it's very intense, but within 1 year, you've got that degree in your hands that you earn and that you deserve. And so it's 4 continuous quarters. We start in July. We actually start like a little Canvas orientation, you know, the online orientation in June. And then we'll be together in person for 3 days in July at the beautiful campus behind me. And it's a great opportunity. You get to know the other members of your cohort. And then you work together online for that next year. And then we come together at the end for graduation. This is a couple years ago. One of our faculty members is featured here, Javon Muhammad, and as well, you know, many other folks working in the working out all around in maternal-child health, and also another of our faculty who might as well be core faculty, Christina, because Dr. Setupath, I'm not even sure I know how to say her last name. I never say it. We're so happy to have her as well. She also teaches in public health. So as we said, this degree is primarily online, and we have some core courses, all focused around perinatal health, postpartum health, maternal-child health systems. And at the same time as we have these core courses, we also have courses that are really have a community focus. So you'll be doing projects relevant to your own community that are really of your own design. And then one big project, which we call your independent project, which can be research-based, it can be a capstone, and we'll talk a little bit more about what those can look like. So is this program for you? Maybe you're an experienced health professional. If you believe in the midwifery model of care, you really want to have that positive impact beyond just that one-on-one care. If you're committed to social justice, reproductive justice, and health equity, if you want or need a graduate degree focused on perinatal, postpartum, and infant wellness, and if you would like to learn and work in a multidisciplinary environment, it could be the degree for you. So I'm not going to, you know, belabor each point here. You know, this will be available as well on the website. We have our core competencies. Really amazing. It's the kind of thing you want to be spending your days doing. Thinking about and learning about ethics, human rights, social justice principles, right? How do we apply data at every level, right? How do we, you know, find practice models that we want to, you know, scale up, right? And then how do we gain stakeholder support and promote those health improvements? and everything from thinking about healthcare delivery to advocacy to leadership to finance models. We've got it all for you. we have a bunch. It's only a year. We've got a lot of good stuff. And so I'm not going to go through the whole curriculum. You can look at it on the website as well. But we've really tried to design something for you that is both interesting and impactful. So we start out with power and privilege. We spend quite a bit of time on research, design, evaluation, and application. We think about the healthcare systems as a whole and health policy, advocacy, right? Culture and social justice, leadership, as I said, and then you're going to have that independent project. This is two of our alums, one from the MSM program and one from this program as well, a lactation support professional who used to work for the Department of Health and now is out there doing good work in the community. All right. So again, real world, what does it look like? You've got, credits every quarter, but it's kind of hard to believe. This will be 41 weeks of school and you get your degree. It is 41 amazing, intense weeks, but you do get those breaks in between. Some folks work, and I did at the beginning. I was glad to work less at the end, but yeah, we've got a great setup for you, as we said, with those 4 quarters. So again, starting in July, ending in June. This is our graduates from this past year. And so, thinking about how do you get prepared for this program? You may already be prepared, or you may have a couple things to scramble around and, get in order to be able to complete an application. If you have a bachelor's degree, that's kind of easy. Otherwise, folks have equivalent education and work experience, and those get looked at on a case-by-case basis. If you graduated from an accredited midwifery school, that counts as well, even if you didn't get a bachelor's degree per se. We do look for 2 or more years of work experience in reproductive health, childbearing, and or infant health. And that's because this, as we said, it's very intense, and it's people who are already doing that work in the field. So not going straight from college to this program, but having that work experience, that lived experience. Katie, did you want to ask a question?
Yes. The bachelor's degree is or a statistics course or in addition to.
Yeah, so we'll definitely talk more about that. So if someone has the bachelor's degree, they still do have to do that statistics course. And that's something you can kind of squeeze in between now and then. But if, and no matter what, we really want that statistics course. So whether someone has a bachelor's degree or not, that is the one thing that we think, because you're going to jump right into those research classes, having that background in statistics and starting to get your feet wet with that will really help you do more with the learning in the research classes. And so whether someone comes in with the work experience that they want us to look at or the bachelor's degree, we really do think that statistics course, and it can also be a refresher course if someone's already taken it once. Does that help answer for now, Katie? Yeah, good. Okay. And so other prerequisites somewhere along the way, some English composition and writing, although we also can work with writing samples. And then that public speaking course, or again, that demonstration of your experience that you have already experienced public speaking. So those are how to be prepared for the program. And so, yeah, why you? Why might this suit you? It does cost money. Getting a degree does, but it really is only 1 year of credits. So you can look, and it's very comparable, sometimes less than other places, because you're doing it in that 1 year intensive. There are scholarships and financial aid available. And yeah, we're so glad you're here because we believe to make change, we need a seat at the table, even if part of what happens is a table getting upturned. We've got to have a seat at it to be able to help make that transformative change we want to see. It can help to have a master's degree, and sometimes people really need it to be able to move to that next level. So the program's online and flexible, and you get to stay in your own community. I have just here some quick photos, including Cassandra's on the next one. These were you can see some examples of our amazing independent projects that the students do. These are just from the last 2 years, but really you get to pick that project that's something you really, really care about. And you get to spend a whole year doing it. And it is just really amazing what people come out with. And you can watch on our YouTube channel any of these that you're interested in. Really some amazing stuff. So I do, everything from systems change for doulas to thinking about perinatal loss, to thinking about sex education, postpartum depression, just so many amazing projects. Some others from this last year, thinking about family-friendly work practices. We have Cassandra here focused on, transformative change for survivors of intimate partner violence, thinking about a toolkit for lactation support professionals, for folks with disabilities. Really, you just can pick that project that you really care about and just run with it. And it's so cool to see what folks do with that. And so we'll try to get that link in to the YouTube, but you can look these up to be able to watch them if you're interested. I mentioned earlier, Trinity was the year before, thinking about improving lactation for Black parents. We also the year before, thinking about the ways we're siloed in midwifery education and how can we bring together midwives and doctors to be able to work collaboratively. As we said, another of your faculty, Javon Muhammad, thinking about how can we get CPMs to be able to work in federally qualified health centers, associating them with freestanding birth centers. So just amazing, amazing work. And then also from the year before, thinking about, when we can create tools for folks who are in our clinical care. So you can connect with admissions for specific questions. You can connect with myself or Dr. Taiwo. But for today, we get to hear from, as we said, our amazing alums. So I'm going to switch to gallery view. So anyone who wants to turn off your camera, feel free. We also would love to see your faces. All right. Okay. Thanks, Tanya, for being in there in the chat. I couldn't do both at the same time. Welcome. I see we have some additional folks who have joined us today. So thanks again for being here.
Hi.
Yeah. So any specific questions for our alum, and then Dr. Taiwo and I are definitely willing, of course, to answer any questions you have as well. Colette, would you be up for going first? I know at some point it's going to be really late for you.
Okay, sure. I'll go first. So I discovered Bastille a couple of years ago. I was searching. I wanted to go back to school, wanted to do maternal health, but I didn't want to be in school forever. And it's a really interesting story because I called and I did a consultation with Courtney then. And then I didn't do anything, just left. I was like, well, I'll think about it, went to live my life. And I had a friend go to a conference with one of the professors was there. And my friend knew that my friend name is Tamara. I think you know her. She went and she said, my friend wants to go to school. She spoke up for me. And she called me on the phone. I said, well, ask them how I could get in without taking statistics. And so I ended up calling one of the professors and we had a really nice conversation. I actually called Nancy Anderson. I think she's retired. And I talked about statistics and she was like, well, you really need the statistics. I was like, oh, damn, I need statistics. So I found myself some statistics. I actually took it online. So this might be good for you, Katie. I took it online at Mohawk Valley College and it was online for like 8 weeks. And busted out and then just applied and the rest is history. I've never been that far west before. I mean, I've been to Utah, but I wasn't as far west as Seattle. So that was a nice change. And of course, the time change was interesting. But I really enjoyed the courses. I enjoyed, the professors are some of the most supportive professors that I've ever had in my life. They really are interested in seeing you succeed and do well. The classes were top tier. So I have nothing bad to say about any of it because it was a really, really great learning experience. And I'm truly grateful that I was able to do it when I did.
And me too. I remember, yeah, when you were in class, and maybe you can share, just for the folks who came a little later, your name, where you're located, and what kind of work you do.
Okay, I'm Colette Sturgis. I'm in the Bronx, New York. I'm actually a program director for Perinatal Infant Community Health Collaborative. It's a grant-funded program, and we have community health workers designed to do home visits to outreach most at-risk women in the Bronx community, provide them with health education, information, support, referrals, and I'm at a federally qualified health center in the Bronx, and I'm just it's a wonderful experience. So I remember the class about grant writing, and I remember thinking, why didn't I have this when I first started working? I've been doing all of these budgets and these scopes, and so just taking the class, and it was Dr. Taiwo's class, which made me feel so much better because I was doing the things right. I didn't have like a practical classroom knowledge when I started doing those budgets and those scopes. So now I'm definitely much better at it. Even though I've had lots of experience, but doing it before because you were thrown into it and you got to do it. But now, as I've been doing this, it's so much easier. It flows. I can just do a budget, and now the funny thing is I don't have to do a budget. My finance department does a budget. I just tell them where I want them to put the money.
Colette, uh, um, what did you do before you started this program?
I still was working at um my job doing the perinatal and community health worker, maternal infant health stuff. I've been doing that for a really long time. So this was just a boost to my knowledge, helped me put definitions where I needed. It gave me a better outlook on what I was really doing because you have a feeling for it, but where are the words for what you wanted, why you're doing this. And so that this program gave me um, a sense of having the knowledge to talk about what I was doing and have people understand what I was saying. So I've been in this field for a really long time.
When did you get the finance department to be able to do your stuff? How did that happen?
Oh, well, they just put those things in place. We have a finance department because I was always struggling with these budgets, and my colleagues are like, why are you doing that? The finance department does it. I said, well, why no one told me this? I could have gave this to you for a long time. I could have given this to you 10 years ago. So now, because that's the process, we get a budget. I just tell them where to put the money, what I want to spend it on.
I see that a couple of people on faculty are CPMs. And so I'd love to hear the conversation, especially for the folks that are CPMs. How does having this program maybe shift your scope? Is it like one side, but then also like as a person, why you chose to get both? Like as a CPM, I'm imagining a scope, and with this program I'm imagining a scope, and so maybe what's the kind of bridge? What bridge were you interested in? Yeah, what has been your kind of like distinctive experience in both and not working with them together?
I will. So I'll take that question. So Katie, I wish that this program had existed before I got my MPH. And so I'm a CPM in California, and I was working at a federally qualified health center, and I kept thinking, midwifery is public health. Midwifery is public health. We need to get this model of care out there in the world and infuse, in every aspect of healthcare. Not even just perinatal health, but it's like, can we bring the midwifery model of care to how we take care of diabetes, right? Patients with diabetes, how we do mental health services. And so I did a master's program, a master's in public health. And, it required travel, it required classes that were not always easy for me to get to. And it took 2 years. And yeah, it damn near killed me. And so as soon as I got my MPH, it was within months, the leadership, the CEO, like all of a sudden he knew I existed. And then it was like he made me the can't remember my title, director of women's health. And so instead of working in the clinic and our little midwifery clinic I was now overseeing multiple clinics and multiple providers. So I was overseeing doctors and PAs and NPs, and like saying to them, like, no, you can't turn people away when they're late for their appointment. No, or I could talk with the billing department to say, like, no, we are not turning away any pregnant woman because their Medicaid isn't working today. We're going to take care of them, and then they're going to get Medicaid, because even if they don't take care of it, the hospital is going to do it. And so we need to just do the work, and y'all need to do the work so that we can get paid 6 months from now. So it was like, my program was not, as focused on maternal health as this program is. I didn't get the opportunity to do an independent project, like, the way this program is designed. But I think that having a master's degree as a midwife, as an LM, CPM, people just look at you different. It's not right. We have skills, we have leadership, we have a lot of knowledge and the midwifery model of care behind us, but yet still having a master's degree allows you to bring that to more people. So I hope that answers your question.
I also
It
wanted
does.
to add. Oh, can I add to that really quick? Because
you are a certified midwife.
I'm a CPM. Yeah. So go ahead, Sandra.
I'm a certified professional midwife as well. And so one of the things that, it doesn't change, for me, it doesn't change my scope. It doesn't change what I'm allowed to do depending on what state I'm in. But it does, just like you were saying, it does change how people respond to me. And it's very different even than I have colleagues and friends that have a master's in midwifery, and they're still like, I'm still the person that is kind of come to for big systems level things. And because I'm a CPM, because the midwifery model of care is just my heart and soul, then that's what I'm focusing on. I'm midwifing systems now. So I just have a new scope.
That was very well said. I am midwifing systems. I stand by that. That sounds amazing. But Cassandra, if you could and also anybody else who's in the space that has the same credentials, what do you feel like as a like, had you not had a CPM before you did this program, what would be a difference that you bring to the table versus now that you have this?
If it's okay, I might actually have something for that too, because though I do have my CPM, I don't work in midwifery. Since graduating this program, I work for the National Resource Center on Domestic Violence as their perinatal health specialist. I'm the manager of program innovation. And so my sole focus is looking at community birth and birth for Black women and birthing people and their families. So I'm not doing the one-on-one clinical care anymore. I don't know if that answers your question, but I wouldn't be able to do that without this program.
And I did do 9 years of clinical care as a CPM before doing this program. I was in the first cohort before I got to teach in it. So back in 2017, I guess that was. And I adored snuggling little newborns. That's actually the thing I miss the most. Oh. You know, normal people don't get to do that all the time. That's the thing I miss the most. But also, I thought I would miss the most, and I still do miss just pregnant people and their little bellies and their big bellies, and of course, and that one-on-one. But I also was tired. Had my own family. I didn't want to be on call all the time anymore. And I wanted to affect change on a larger level. For my project, I was very much interested in trying to be some small part of helping to transform midwifery education to be more anti-racist, and to focus on, removing bias and oppression as much as we can from those spaces. And it was amazing to have a whole year to spend on a topic I really cared about, as well as a bunch of other projects. I just remember Colette mentioned Dr. Nancy Anderson. This came from her and it's still in our curriculum. Just, okay, we've got these folks who are impacted by lead. What are we going to do? What about the pregnant, all these people in Flint, Michigan and their babies and their, and just to get to really think through these and think about midwifery and perinatal and postpartum health as public health. And to just bring that all together. So I don't know if that answers your question, but yeah. You've got some stuff in the chat.
Oh, that's me. I was trying to tell Cassandra that I wanted to steal her concept of midwifing systems, and I also wanted to say I want to hear from Amanda, and then I put the two of them together in one thing. But I do want to say that part of the impetus. So this program was the brainchild. Nancy Anderson was one of the designers, but there was actually a think tank, and it was a weekend where we had midwives and public health folks, and I think an epidemiologist and researchers who came together and dreamed up this program, and with the idea that we would have a place for midwives to go when they needed to hang up their Dopplers, and wanted and so that we could get more midwives and then more birth workers into positions of leadership, so that we can really, as Cassandra said, we can midwife the systems of care that are so absolutely broken.
Yeah, thanks for that, Tanya. With a little pause, maybe Amanda, do you want to tell us your name and what you're doing these days and a little bit about your experience with the program?
Yeah. So Amanda Powell, and I live in Maine, the total opposite. And I've been a doula for 10 years. And so I was doing the doula work. I was a medical assistant, working in different kinds of medical offices, working at Planned Parenthood. And I just felt like I wanted to work more on the systems level of things, but I really did not want to go back to school and do everything else. Like, I just am obsessed with maternal health, so I only wanted to focus on maternal health. And I was like, oh, I should do an MPH, I should do that, and I can have like a concentration in maternal health, but I was just really stubborn. And then I found this and I was like, oh, this is all maternal health for a whole year. That's great. And I was, pretty concerned about it being online. This was before, COVID. So I was like, I don't know about that. But then we had, the first week we went on campus and we met each other, and then we saw, our whole bodies and all our mannerisms, and it felt like we knew each other. And so then once we got back on the video for the whole year, it really didn't feel like there was a disconnect. And Colette and I are East Coast buddies, so we were doing all our classes at like 10 p.m. and so we had that together, which was nice. But yeah, it was really exciting to find this master's degree that I felt like was attainable and was on something that I really care about. Every topic was about maternal health. And the camaraderie, just to be in a class with a bunch of people that have the same or birth nerds with you, and you can just like talk about, you can't do that in your MPH, I don't think. So I thought that was really exciting. And then since I graduated, I now work at Maine Health, which is our biggest like healthcare system in Maine. We have 9 hospitals and a bunch of different, like family practice and all that kind of stuff. So I work in the child health department, and I am in 3 programs, so just bear with me, but it's Maine Mom program, which is maternal opioid misuse, and that's working with providers that support moms with substance use disorder. And then the childhood lead screening program, so getting these lead screening machines into offices and helping sites train on them. And then we just got a new grant called Our Moms, which is rural maternity care, and that is trying to find ways in Maine that we can support rural maternity care with telemedicine and other things like that. So, and I did, as Kristen knows, my project, which I think is like the hardest and probably best takeaway from this, is your independent project, because you do it the whole time. But I did that on rural maternity unit closures and trying to find a deliverable for that. I wrote a how-to manual for bringing mobile vans to rural communities and the midwifery model of care. So it's kind of exciting now that I'm working on a grant that has to do with rural maternity care in Maine. Yeah, so I'm happy to answer any questions, but that's my spiel.
I can always come up with more questions for our panelists, but I want to definitely leave time for Katie, Ashley, Jackson, Nadine. Do you have any questions? Or if you'd like to share a little bit about yourself or what you're looking for, that might help stir some conversation from our graduates.
Yeah. I'm Katie. I am actually a dancer and a singer and a songwriter and an astrologer and all those kinds of things. I work a lot in like embodiment spaces, and I most recently became a doula. And I don't know, Colette, I don't know if you know about this, but New York just opened its first postpartum retreat center. It's on Fifth Ave. Yes. Oh, wait. Oh, I thought you said Jamie, but anywho, so I worked at that postpartum retreat center for quite some time, and being a dancer, being a doula, they're very similar in that like I'm always in nonprofit spaces. I feel like I'm always brushing up against capitalism in various ways and trying to co-conspire to create like healthy work conditions, both for employees, but also for moms. Our smallest infant at that retreat center was like 2 days. But that owner is a business owner. And so I felt like I was like, really just like, you're not making any sense, right? Like a 4-to-1 ratio is just not like of sound mind. And so I definitely feel a call to midwifery. But I think, like I said, having that like artistic background, I can see systems really well. And so I'm curious about how I can kind of ride that line, because I do love being with families. Like you said, Kristen, I love the bellies. I love the cuddles. I love postpartum care. I love cooking for families. I love building those relationships. But it also would be dope to be able to make change. I know in my community right now, I'm seeing a lot of fibroids and I'm seeing surgeries at like my age, and I'm only 29. And so if I could just do anything to offer information, it just, you want to make a difference. You want to make sure people feel held and safe.
Ashley, I know you were on early, and then you'll have to help me with your name if Kayla Saraja, maybe. Feel free if you have any questions, or if you'd like to share where you're located and any questions you have or information.
Hi, I'm Ashley, and thanks for everyone who's spoke. And I've been looking for something like this for a long time. I worked as a doula, as a volunteer, and then professionally part-time for 5 years, a little bit longer than that, and also as a yoga therapist. And then I actually worked for the federal health minister as a policy advisor for a couple of years. Right now I'm a consultant. So I find this program, like someone said, like it's birth for birth nerds. And I really am interested in working in the systems to promote reproductive justice and equality, because even just seeing how things have evolved from when I became a doula to now 13 years later, I see like a lot of ways we've moved forward and a lot of ways that we're still stalled, and how these small systemic changes or just realizations that they're what the problems that they're causing and the outcomes that can stem from them, and the more people that we have to sort of point at them and say, look, can we just even experiment with this, and then the outcomes from there. I just think it's so powerful. So I'm really interested in this program, and again, thanks. And if you think that this sounds like, from the graduates, if you think that it seems like a appropriate program for someone like me, let me know. Thanks.
Yeah, I think being a doula also, I think it really did give me a boost. Like a few people said, unfortunately, having a master's behind your name really makes people look at you differently sometimes, or you might get jobs that you wouldn't have got before. So that's a good and bad thing, but it's it definitely happened to me, I think. So and yeah, I mean, it's just like a full maternal health focus for the year. And it's just really exciting to do the data part of it and, learn more of the data systems in the birth world. And then the research was really interesting too, even though it was hard, but it was good. And being able to pick your own project, and really it's like a passion project that you can figure out what you really care about, and you can do it within your community. And a lot of the homework we did like within our community, you know, you would like pick data from your area, or like pick, I'm trying to remember like all the homework that we did. Anyways, most of the things that you do, you can relate back to your community, which is a really exciting tool to be able to have too. So
Thanks, Amanda. Yeah, I was thinking of you, one of our doula graduates. And I also want to make sure Cassandra got to speak a little bit, but we didn't give her, space as a graduate to make sure we get to hear your name and what you're doing now, and a little bit about your experience as well as a student.
Thank you. Yeah. So my name is Cassandra. My pronouns are she, her, hers. I was a CPM before. I'm still a CPM, but I had graduated midwifery school when I found this program. And, very similarly to what Colette was saying, is I felt like I had these like very deep feelings of, I know the systems are failing and I know they can be fixed, but I didn't have the right words to describe it, or maybe all of the processes to show with data and evidence on how my brain was there. And so this program really opened a lot of those doors for me. I will not sugarcoat it. This program is tough. It's not an easy, yes, it's a year, but this is an exceptional program that does want, it's a top tier program, and it wants top tier results. It wants students to really be all in. And my situation was certainly different. I was working full time. I have 4 children, and my husband was deployed throughout the majority of the program. So Kristen was most privy to my meltdowns, but similarly to what Amanda said, like I've never felt more supported ever by faculty and by the students in the program. It was my cohort was one of the graduation pictures in the slides, and I just got super teared up. I wasn't able to be there in person, so I was like texting all of them while Kristen was talking, like, I love you, I miss you. We became like family. Now I work, as I mentioned, at the National Resource Center on Domestic Violence, because there's a huge intersect between domestic violence and pregnancy and postpartum, and I had seen that for many, many, many years, and I felt like no one else had seen it, and the data wasn't there, and there's all this information that's missing. And so my project was a framework on a community response model. And the reason I bring that up is because it wasn't just healthcare. My framework was talking about police officers and child welfare and advocacy services and healthcare. Because in order to achieve health equity, we also have to make sure that there is equity in other systems as well that impact health. So yeah, this program really just changed my life in the best possible ways. So, but it can be done. It's hard, but it can be done.
Cassandra was offered at least one job while still being a student as well, right? Just because she would tell people about her independent project.
Yeah, it's true.
You did start that job, I think, during the program.
I did. Yeah, I did start that job, and then moved on to a different job that has been, it's phenomenal. The National Resource Center on Domestic Violence is one of the few national organizations that is really looking at racial equity and health equity and gender-based violence as one big issue. And so it's really incredible. Yeah.
I just want to say, Cassandra, that makes me so happy. Just remembering talking with you and all the conversations we had as you were working on your grant program plan and how much of your passion for that work came through, and the fact that you're actually doing it right now is just really, yeah, I'm just so happy for you, and happy for all of the people who are going to be affected by what you're going to bring to that arena.
Thank you. I just want to tell you too, I just got approved for a proposal for 4 regional convenings that are focusing specifically on the intersect between Black maternal health and Black maternal mortality, gender-based violence, and COVID. So we're doing, it's the first time ever that this organization is bringing in midwives and healthcare providers to talk to advocacy organizations and state coalitions, and it's going to be incredible.
Yeah, that's amazing, first of all. But that just reminded me of another focus in the program, which is talking to people with lived experience. And I really took that lesson away from all of this. And I applied it recently, which was cool. We did we're doing it's called baseline mapping. So we're trying to figure out what all the gaps are in Maine for rural maternal health. And I was like, how are we going to get lived experiences? And I have a connection with the WIC program. And so we were able to send out a text message to like 2,000 WIC participants in Maine and ask them, these survey questions, and get like written, paragraphs from them of like what they were going through. So that was really exciting. So yeah, you definitely learn lived experience is important, and having an equity lens on everything also is a big takeaway from this program.
Yeah, Colette, I was wondering, and obviously you're doing amazing community-based work as well. I was wondering if you want to talk a little bit about anything, but also maybe your independent project, if you're interested to mention it. I don't have yours on video to share with everyone, but we got to hear a little bit from Amanda and Cassandra.
Okay, so what I do is, so when we talk about lived experience, we actually had a listening session, and my programs had listening sessions because the commissioner, the health commissioner at the time, he wanted to understand why Black women and other women of color were experiencing adverse birth outcomes. And so we had about 49 people talk about what they experienced as they were having their babies. But that has nothing to do with my capstone project. Not a thing. My capstone project, I just wanted to throw that in there because I remember that I was stressing out over that and being in class and working. And but my capstone project was to create a perinatal support person program to just, to support women who were support women in birth. But my dream in life, and I don't know if this is going to come to fruition or maybe somebody else will take my dream over, but it's to have I don't want to call it a clearinghouse, but a place where we have all the doulas and we send them out to service the families in the community, and the doulas are getting paid a living wage. They have health insurance, they have 401(k)s, Bs, Qs, Ks, and all of those things that you need to survive in this world. And I always think of it as that we have, I have a staff meeting of these folks who are doulas, and we talk about what it is that families need and what did they hear families say. And then, somebody would call us up and say, hey, I need a doula. And then we would send someone out. I would have come meet the doula sessions. We would come in and have people come in and want to meet the doula and things like that. But that is part of what I'm envisioning when I think about my capstone. I'm not sure if it's going to come to fruition because I'm older now and I'm living a life of ease and contentment. So I can forward that dream to someone who wants to take the reins and, you know, who's younger. Because I love what I'm doing at this particular time in my life. It brings me a lot of joy. When I'm interviewing people, and it's usually women that I'm interviewing, and I hear what they're saying, and sometimes they don't know a lot about reproductive justice and equity lens, and I'm like, oh, that's a good person to hire. Let me bring that person in, and so that is what my charge is to, whenever I see a young person and they're interested in being a community health worker and interested in serving communities, I always, and my friend is like, we inveigle them. I inveigle them, come work for us. And, you know, and that's what I've done. And I think that it helps them become better people, better parents, because they see the things that other people are going through and kind of point them in the right direction to have a healthier birth, a healthier lifestyle, and to maintain that. I don't know if any of that made sense, but that's just what I was feeling at this time.
Colette, was it you that made up the term maternal vitality?
Actually, I did not make up that term, but I got it from a colleague who works in Tennessee, and she called it, you know, because she's tired of hearing maternal mortality, so it's more maternal vitality. We want to improve maternal and infant vitality.
Colette, does your dream feel kind of pushed forward with New York's citywide initiative?
It could. I'm not sure if I'm there yet because I'm not sure how folks are paid. You know, doulas definitely need a living wage, and I think there's so much misunderstanding about what doulas are, who doulas are for, what do they do. I've been a doula long time, but I haven't doulaed, but I've always kept that lens. And I realize is that a lot of people they're misunderstood. They think the doctors think they're coming in to move them out the way. The midwives think they're coming to move them out the way, but really what they're doing is supporting the parent. And I think that people forget that. So I'm not sure where that program is going. I hope it does go in the right direction. I know there's a lot of advocacy around it, so hopefully it'll come to fruition and be what it needs to be for the people that need it.
Yeah, thank you so much.
You're welcome.
Well, it is definitely getting late on the East Coast, but we also did tell people that we could hang out longer if there are other questions. So, and I think I brought 3 East Coast people, which I'm just realizing. It's funny because we have plenty of alum who are not East Coast, but I'm just making you all stay up late. Sorry about that. That just happened. I don't know how. But it was fun to connect with you all. There are a few people who haven't asked any questions. I want to make sure we leave space if you would like to ask any questions to our additional attendees. I know Ivy, you've jumped on, and Nadine, Jackson, Jamie, feel free. If you have any questions for our alum or for Tanya or myself. And it's also okay if you don't. And you can also email us later.
I think one of my questions that I forgot to ask you the other day when I harangued you with questions, I'm Jackson, and I'm a CPM, just for everybody else on the call, and I have a baby who some of you might have seen in the so really going to this program now is really, I'm just trying to figure out how not to go back on call and still survive in capitalism. So and also, like, because midwifery, like, I have prioritized serving Medicaid clients in my career, midwifery does not pay me very well because Medicaid doesn't reimburse very well, which has made me think a lot about what are the policies that are causing barriers to care. And then, like, I don't have a bachelor's degree, I just have a midwifery certificate, and I don't have access to, you know, a lot of jobs that I could potentially do with my experience and my skill set. This is Elio. So these are all the reasons I'm thinking about doing it, is wanting to be able to like have more choices about what I do with my life. And also advocate on a bigger scale. Like I started midwifery because I wanted to make more of a difference than I could working one-on-one with families. I was working as like a postpartum doula and a nanny. And now I'm feeling like midwifery, I want to make a bigger impact than I can with midwifery alone. So, but my question is just like, I know that I have some, like I'm neurodivergent and have some learning disabilities. And I'm guessing I'm not the only one, because people who are drawn to birth work in general tend to be, you know, spicy brained. So I'm just curious.
Oh,
like,
wow, they're still on Zoom.
so I'm just curious if anybody like has, in like any of you guys who are alum, like maybe if you can speak to like if you are willing to disclose if you have any kind of like struggles in traditional schooling and how you felt like this program compared to traditional school settings, or if you as the faculty can speak to that, like because I'm an atypical learner.
I mean, hopefully it's okay to jump in. I definitely struggle in the typical learning environment. I also am my worst self-critic and feel like if it's not 100%, I'm failing at life. That's just who I am as a person. Kristen knows that well. I, again, have never been so supported by instructors ever. And one thing that worked for me personally was because this program is really about true lived experiences, and each term builds on the next. And so many of the assignments that you're doing throughout the year, like what worked for me was they all somehow went into my capstone. Like somehow it was a piece of my final product, or I just stuck kind of with that theme of what I was working on. But yeah, like there were certainly times in my, in research classes that Christina would spend extra time with me if that's what I needed. As long as I took the initiative to reach out first and say, hey, I already know I'm going to struggle with this, or I'm preparing to struggle with this. Can we set some time apart? So I don't know if that's helpful, but I really felt well supported, and kind of learned how to make this program work for me, even if it was challenging, if that makes sense.
Yeah, I agree with you. I can't even remember, I can't even remember what the grading system was like, if it was like ABC or whatever, but it didn't feel like that stressful like previous schooling. It just felt like we're all talking about this, we're trying to learn more about this topic we're all really passionate about. And yeah, so it just felt like we were expanding. I mean, it was very hard at times. Doing it in a year is a lot. And the research part is kind of hard, but it was really, I just felt really supported also.
And I think the key word is the support. It was there, I think that the professors, they want you to succeed. They want you to succeed. So there are things in place to help you do that. So I probably wouldn't recommend taking it in a year. I would probably stretch it out. But there were so many wonderful things in place to support you, to make sure that you were successful, it wasn't horrible. It wasn't terrible. It was actually, school is wonderful. Like, really? Yeah, it was wonderful. So, but I do think that having the support of the professors who want to see you succeed was the biggest thing that helped us to succeed.
Thanks
And
all of
our
you for
peers.
answering.
I was gonna say, and our peers, at least in my cohort, like we had study groups. If somebody was really skilled in one area, but maybe not the other, like we'd trade off and tutor each other. So that's a really important bond too that I just miss so much every day.
Oh my gosh, you're reminding me. Did this program before Zoom. We used to do conference calls, and I was like good at stats, so I'd be like trying to help people with their stats like on the phone. But we'd be like, help us understand this and talk it through. Yeah, you're bringing it back, the memories.
And also the funny thing about this program is it taught us how to use Zoom. I mean, we never Zoom. I know that I've never used Zoom prior to taking this program. And now I'm on Zoom every day, 11 times a day, but I attribute my use of Zoom to this program.
I know it was funny because Colette and I were 2018, 2019, and we just felt like we were pros at Zoom once the pandemic happened.
One thing I do think helps, and I found this for midwifery school too, right? Because if you're in a just, really vague bachelor's degree, or, you're just kind of can be all over the place. But when, with this and with midwifery, you're really focused, and for my brain, that's amazing to just go with like these things I really care about. And that for me made a difference too.
That is one of the appealing things, is because I have a almost pathological avoidance of anything that's not interesting. And, perinatal health and social justice and equity are the things that I find interesting. So a program that's just that sounds great.
Did anybody on this call use financial aid or scholarships?
They did offer scholarships. I did get one. So I did use that. Yeah.
Colette, how much did you pay out of pocket with that scholarship?
A lot. But keep in mind that I'm older, right? And I have other things that I can pull money from. So but I don't even remember. I don't even remember how much tuition is. But I did get a scholarship, and I want to say it was I don't remember that. It might have been $1,000, which is okay in my book.
And we do have a little bit more scholarship money than we did a couple years ago available as well, for people, which is exciting. I did loans. So I just decided it was important enough to me, and because if you work in public service for 10 years, you can get those loans paid back if you're working full-time in public service or for a nonprofit institution. So that was my strategy. I know you worked full-time, Colette, and you just like went for it, but I went for the loans. If anybody else is comfortable talking about money, feel free as well.
Yeah, I did student loans also.
My plan would be to take out loans and live on them, but partly because I have them my eye towards the working in public service, and like right now my midwifery degree and my skill set alone doesn't qualify me for most jobs at a nonprofit, but a master's degree would potentially get me to be able to work in that public service sector where I could get a loan forgiveness.
So Jamie, you've had your hand up for quite a while.
Sorry about that. I put my hand up and then my doorbell rang. Somebody brought me a charcuterie board out of nowhere. I'll take it. Hi, nice to see you all. My name is Jamie. I'm a midwife. I live in Portland, Oregon. I'm also an employee at Bastyr in the midwifery department. And yeah, considering this strongly, I'm so happy to see some other Portland people and a Portland, Maine person. My question, I'm sorry that I arrived late. And maybe you already answered this and that's okay. I can watch the recording. So just let me know. But is it possible to work full time and do this program and not become totally, the reason I am pulling back from my midwifery practice is I need to sleep. I need to not feel like I'm constantly on the edge of sanity and, feeling ungrounded and too busy all the time. I've heard a lot of us talking about capitalism tonight and how much that is impacting our life choices. And it's certainly something that is impacting mine. So yeah, can you be a full-time employee somewhere and do this and maybe also be pregnant or have a baby? How possible is that?
I worked full-time and didn't have a baby, but I did have a teenager. I worked full-time, but I have a unique circumstance because I'm mostly in the office. So although I have staff who do home visits, I oversee the program. So I was in a unique position where the work that I was doing was in direct alignment with the work that I'm doing, my capitalism work. So I was able to work full time, but I also got it. I was very privileged because I had my own office and I would shut the door and tell everybody to leave me alone, and then I would come out. So I would do, and I did ask my supervisor if it was okay for me to do some of my work at work, and she was okay with it because my work, my schoolwork and my work are basically the same thing. So you can work full-time if your job has a lot of flexibility for you to do so, but also I still had to go home and do work. Right? I had to do housework and teenager work, and sometimes I brought my work home. So, but it's just a matter of trying to find a balance. And I think I achieved a balance. There were some things that I did have to pull back from because I was also a Girl Scout leader, and I really enjoyed being a Girl Scout leader. But I was in school, so my Saturdays when we had our troop meetings were the days that I could not go because I wanted to get this 11 page paper out and make it have some sense, like a cohesive sentence with no grammatical errors, right? So I did pull back on that. So some things I had to pull back on, but I did eventually find balance. And sometimes that's what it is, finding a balance. How can you do this and this and this and this? And you kind of had to break things into smaller pieces. I'm not using any more big words tonight. Break things into smaller pieces to fit them into your timeline. So yes, you can, but there's a lot of give and a little take.
Yeah, I would also add, like, Colette, I can tell I'm not as chill as you because I don't think I ever found that balance. However, my circumstances was also a little bit different. I mentioned earlier, my husband had been deployed. I have 4 kids. The youngest when I started was 6 months. And I worked full time, and I didn't have an office that I could work in. Like, my boss, even though I designed it around them, was like, do that on your own time. So that being said, I would still 100% do this program all over again. Like it didn't kill me. It was hard. It wasn't easy. I was tired a lot. And sometimes I would cry just because, but it had nothing to do with the program. It was just life. And I would 100% do it all again. And I don't know if you caught, but much of your coursework builds to the next thing. So kind of like once you have a piece, like you've already got a piece of the puzzle with the next one. So you're never feeling, I never felt like I didn't quite know what I was doing, or I never felt like it was a whole brand new concept that I couldn't figure out. It was just like, okay, I got to sit down tonight, and maybe I can't binge watch a show, but because I have to write this 1,000,000-page paper, I did not focus on not having grammatical errors. I just was happy to get a sentence down. But it can be done for sure.
Cassandra, I feel like we had similar journeys. My paper ended up being 120 pages, and I feel like I blacked out for half of it. When I reread it, I'm like, what? But it's amazing, and Kristen helped me through it, even though it was a very long journey. But yeah, I could not work full time, and I think it's amazing that other people did. There were a few people in our program. Someone was a full-time midwife. She had a practice, and I had 2 part-time jobs, but I ended up stopping one in the middle to focus more on it. And I do think it's just personally how much you can balance, or how your brain works with stress and all that. So I wouldn't recommend it, but I know it did work for other people. So really depends. Yeah.
So I do want to jump in and say too that the program was actually designed for working professionals. And I think it's rare that rarely have we had students who have not been working full time. I think they're more the exception than the rule. So I can't speak to the student side, but I can speak to the design side, so just in terms of mechanics, our synchronous classes are on Tuesday and Wednesday nights. And we give you a schedule. We try to have the schedule out to you, at least by the first of the the first week of the quarter, so which Tuesday and Wednesday nights you have classes. And so you have the residency in Seattle for 3 days, and then the doing your capstone and graduation at the end. So July for the residency, and then June for graduation. But then other than that, the Tuesday and Wednesday nights for 90 minutes are the only time that you have to be at a certain place at a certain time. Other than that, you have flexibility to work at whenever.
And I think it's choice, what works for you. And I was working as a midwife and teaching, and then I got pregnant. So then I was like, this is a lot. And school, for me, because my first trimesters are hard. And so by that point, I was ready to work less and just teach and run midwife lobby day and have a toddler and be pregnant, right? So I think you just have to think about all the things, right? And what might work for you. And it's also possible to do part-time, or you can start out full-time and switch to part-time. So there definitely are options. If you start out and you're like, it's too much, I want to switch to part-time, we do have that option as well.
Does the part-time still would probably be every Tuesday and Wednesday night, but it would oh wait, I'm remembering now. Your project just happens the next year, so you just have your classes first, and then you're doing your project the next following year.
Although we are talking about whether there could be some different configurations than that. I don't think we have to be 100% set in that structure. So yeah, I'm happy to talk more individually about what that could mean for folks who are interested in part-time, just because I think a lot of people have done it full-time while working full-time. And I think it would be nice to have the option for more sort of part-time options. So yeah. All right, well, we are getting close to the end of the hour here. If something must emerge, I want to let that happen. Ivy, I know we got to talk in the chat, but if there's any other additional things you're wondering about, or Ashley, feel free. Or anyone else as well. Yeah, there's some contact information in the chat from myself as well, and I think Amanda offered as well if people have additional questions. But we're here, you know, there's various departments to answer your questions as well. So thanks so much for showing up tonight. You know, this is my heart work to be part of transforming perinatal and postpartum and infant care. And I adore working with all of you, and yeah, and getting to support students to realize their goals for transforming our broken systems. So thanks again for showing up, and do be in touch.
Thank you.
Good night, everybody.
If I don't have
Thank
your
you.
contact information, if you only used the Zoom link and didn't officially sort of register, I'd love to have it, you know, to be able to, if you contact me, I'll know it's you. Feel free to pop that to me, you know, privately in the chat.
And Amanda, Colette, and Cassandra, so good to see you. So good to see you, and thank you. And Jackson, love.
Dr.
Good to
Taiwo,
see you too.
I would love to have coffee sometime, a Zoom
Oh,
coffee.
well, you know where to find me.
All right, let's
I'm
do
good
it.
for virtual coffee.
Thank you, guys.
All right.
Thank
bye.
you.
Good to see you. Thanks for showing us your cute baby again.
Yes.
Anytime.
Kristen, before I go, call me this week if you can.
Cassandra, always be holding me on as the last person. I'm just kidding. No, let me hang
No,
on. Let me turn off the recording.
I tried so